Good afternoon, everyone. Looks like we've still got a couple of people to admit from the lobby, and then we'll get started in just a moment. All right. Thank you all for attending today. I would like to welcome you to session 2 of our emergency preparedness series for animal care providers. Today, we're going to be discussing founding an animal medical reserve corps for Southeastern Idaho. So starting with some general information, this session is being recorded. Transcription is enabled and will be available. The chat is going to be monitored. I have 2 other staff members here with me. And the Q&A feature is enabled, so feel free to drop any questions in the Q&A box at any time during the presentation. So today, again, we're talking about founding an animal medical reserve corps for Southeastern Idaho. I am the presenter today. My name is Lori Peck. I'm the Public Health Preparedness Planner for Southeastern Idaho Public Health. Today's presentation, we're going to start with a presentation, and then we'll have a little bit more of a workshop discussion component today as well. The agenda for this, we're going to talk about public health in general, since not everybody on the call may be super familiar with what public health is and what we do. We'll talk about how pets factor into public health, some local pet ownership information, speaking about pets in disasters, and then about what the Medical Reserve Corps is. So our overview on public health, I really like the definition from Johns Hopkins University. What is public health? While clinical medicine treats one patient at a time, public health aims to prevent illness and injury in whole communities and populations. It seeks large-scale, evidence-based solutions to help all people live longer, healthier lives. The field of public health aims to understand and address a wide range of issues, including chronic disease, disability, mental health, disaster response, refugee health, aging, violence, injuries, environmental exposures, and substance use. At its best, public health is often invisible. It's the clean water running through our taps, it's disease outbreaks that don't happen, it's the regulations that monitor our food supply for contaminants and keep our air safe to breathe. Public health shows up in our everyday lives in the form of bike lanes, airbags, nutrition labels, workplace safety laws, school lunch programs, public transit, senior living facilities, addiction support groups, the list goes on. So public health is a very, very broad field. Public health preparedness specifically. So we do work with the whole community. Largely, we work with first responders, healthcare providers, emergency managers, community-based organizations, faith-based organizations, volunteers to prepare for any hazards that threaten the health and safety of our community. We do provide training and education to both the community and to response partners. We conduct drills and exercises, and we provide subject matter expertise during an incident to other responders, and we can help coordinate resources and our Medical Reserve Corps volunteers. So for public health emergency preparedness, also known as SPEP, we do have 15 different capabilities that are arranged into domains, just to give you kind of the concept of the different capabilities we have. So we work in community resilience, incident management, information management, countermeasures and mitigation, surge management, and biosurveillance. Now to discuss a little bit more specifically what a hazard is when we talk about that. A hazard is something potentially dangerous or harmful, causes unwanted outcomes. These can be natural or adversarial human caused. Natural hazards are the natural events that pose a threat to life, property, and other assets, while adversarial and human caused hazards are technological and often intentional acts. So as far as our local hazards, so we face the possibility of accidents such as multiple vehicle collisions, plane crashes, train derailments, chemical, biological, radiological, or nuclear, also known as CBRN incidents, These can be accidental or intentional, communicable and other infectious disease outbreaks, epidemics, and pandemics, cyber attacks, such as those that can impact our healthcare facilities, infrastructure, communication systems, infrastructure damage, such as dam failure, power outages, water supply disruption, and natural disasters like earthquakes, extreme weather, floods, and wildfires, as well as terrorist attacks and other types of violence, including bombs and mass shootings. So basically anything that can harm a large number of people is kind of what we plan for, a large amount of things. Do we have any questions so far just about public health and public health preparedness? Okay, I don't see anything, so I will move on, but feel free to drop any questions in that Q&A box again. So we're going to talk about pets and public health. So pet ownership is actually linked to a lot of positive health outcomes. So pet owners have fewer overall office visits to their physician, are more likely to meet physical activity recommendations, which ties into lower obesity rates. It's linked to prevention of certain types of infection, reduced anxiety in children, decreased social isolation of older adults, including improvement of Alzheimer's and dementia symptoms, better management of type 1 diabetes, especially in children who have pets, smoking cessation, improvement of PTSD symptoms, lower likelihood of developing specific types of allergies, lower heart rate and blood pressure, improved compliance with cardiac rehabilitation programs, and just a general lower all-cause mortality. So we're going to talk a little bit specifically. This is just some interesting, these are estimates put together by the Human Animal Bond Research Institute. They did a meta-analysis of a bunch of different studies that have been done tied to health and did some estimates for how much pet ownership could be saving us in our healthcare system. So as far as fewer physician office visits, so pet owners are estimated to visit the doctor less, and they estimate the annual cost savings as $15 billion just from not visiting the doctor as often. Mental health in children ages 8 to 10. This specifically was households with a dog, but these children had a 9% lower probability of having a clinical diagnosis of anxiety, estimated cost savings of $672 million. Older Americans with pets, less likely to suffer from loneliness, social isolation, and the health outcomes that come from that. Medicare spending specifically lowered by an estimate $1.8 billion. Dog owners who regularly walk their dogs have lower levels of obesity, estimated savings of $4.5 billion. Pet owners have a 14% reduction of C. diff reinfection in hospitalized patients, annual estimated savings of $90.5 million. And for veterans with PTSD, this was specifically looking at service animals and emotional support animals, not pets in general, but they estimated the PTSD treatment savings as $688 million. So again, these are just estimates for a few specific scenarios based on the information that was available. So estimate, but the total identifiable cost savings that they came up with was over $22 billion in healthcare costs that are saved because of the positive effects of pet ownership. So that is why public health is interested in pets. But because we are public health, there are some risks of pet ownership that we do want to communicate. So there is the potential for bites and scratches, allergic reactions to pets, a reduced indoor air quality, zoonotic diseases, which are transmitted from the animals to humans, which includes parasites, trip hazards, such as tripping over the pet, tripping over a leash, and children who are younger than 5, those with weakened immune systems, People 65 and older and pregnant people are most at risk, but routine veterinary care and proper hygiene after handling animals, their waste, food, and other supplies does tend to be effective protection for most people for those conditions. Okay. Do we have any questions now? Looks like we might have somebody typing in the chat, so I'll take a moment. Yes, the question is, will this recording be made available to us later? Yes, this series is being recorded and it is going to be uploaded to our YouTube channel. There is a preparedness playlist. These videos do have to be reviewed by our upper management before they are posted, just to ensure that there are no HIPAA concerns with it. It's just policy, but it will be available on our YouTube. And livestock, there's not as much data pertaining to livestock, but I do plan to cover it a little bit in our discussion. So that is a great question. Do we have any other questions? Okay, continuing on. So local pet ownership, we're going to do some estimates here. Most of the actual data is conducted at the national level. There is some state level data that's a little less reliable. The estimated percentage of US households that own a pet does kind of vary between about 60 and 70%. For the purposes of this presentation, we're going with 70% because from a preparedness standpoint, we do like to overestimate the number of people who could be impacted by an incident versus underestimating. So we're going with 70% for this purpose. And pets include dogs, cats, fish, birds, small animals, reptiles, and horses by most definitions. You know, some of us have other types of pets, but most definitions for statistical purposes include those. And in most studies, approximately 97% of pet owners, they say their pets are part of their family. And in one particular study, 51% of pet owners said that they consider their pets to be as much a part of their family as a human member. So Southeastern Idaho, I'm not going to read all of these. I'll leave this slide for just a moment so people can look at their respective counties where they reside. But in Southeastern Idaho, according to the US Census Bureau, in our district, we do have over 65,000 households. And when we use that 70% estimate, these are the estimated number of pet households in our district. So approximately 45,651 households in our district have pets, and so we need to plan for that. As far as pets in disasters, this is the reason that we are concerned with planning. So during Hurricane Katrina, 42% of people did not evacuate. 32% of those people chose not to evacuate. Other people had things like transportation, mobility, health concerns, other barriers that prevented them from evacuating, but 32% chose not to. And 44% of the people who chose not to evacuate, they made that choice, at least in part, because they couldn't take their pets with them. And in our district, this is equivalent to almost 4,000 households of people who would likely make a choice not to evacuate if they could not take their pets with them. So that is a significant amount of our population to plan for. And because of Hurricane Katrina, there is some legislation that came out of it. We'll talk a little bit about what this means and what it doesn't mean. There are some misconceptions about this. So the act is called the Pets Evacuation and Transportation Standards Act of 2006, abbreviated to just be called the PETS Act. So this requires state and local jurisdictions to make emergency plans that take into account the needs of individuals with pets and service animals prior to, during, and following a major disaster or emergency, and provide rescue, care, shelter, and essential needs to individuals with household pets and service animals, and to such pets and animals. So this is a pretty broad definition, and it doesn't really delineate all of what's entailed in this planning, exactly how things are to be accomplished. It just does kind of set that framework. And as part of that, state and local governments are able to seek reimbursement for expenses that are related to rescuing and sheltering animals. This includes facility costs, supplies and commodities, eligible labor expenses, equipment, emergency veterinary services, transportation, shelter safety and security, cleaning and restoration, removal and disposal of animal carcasses, and cataloging tracking systems for pets. So any of those expenses, as long as they are properly documented and submitted, state and local governments actually can get reimbursed for. Some limitations specifically for this act that are kind of relevant to our discussion today. So in the Pets Act, it does specifically define household pets, and in their definition, it excludes reptiles except for turtles, amphibians, fish, insects, and arachnids, farm animals, including horses, and animals kept for racing purposes. So according to that particular legislation, these animals don't have the same requirements to be planned for. So going back to the question about livestock, there is not that legal obligation. Most jurisdictions do try to make some plans for that, but that is kind of a legal limitation. The Pets Act does require a presidential declaration for an emergency. So not every emergency situation that would happen locally would necessarily have this act be implemented. And contractors and private nonprofits can't apply for the reimbursement unless they're specifically contracted by the government to provide some of those services, such as if they are contracted to do the labor. A couple other misconceptions with this. So this is one thing that goes around on social media a lot during a disaster. People think that hotels, motels, Airbnbs, other lodging facilities are required to allow pets. They are not. That is not a legal requirement. And mass care shelters, we did hear from the Red Cross last week about what their mass care shelter policies are, but they are not required to allow pets to be in the same shelter as their owners. Separate household pet shelters can be established. So it is ideal to allow pets to stay with their owners if that is possible, if it is safe and secure to do so, but it's not a requirement. So locally, we're going to talk about the Charlotte fire a little bit. Many of you may remember this. So on June 28th in 2012, at approximately 2:30 p.m. under red flag warnings, a wildland fire started and spread to 1,038 acres, destroying 66 homes and 29 outbuildings in its path. This was the most devastating wildfire that Bannock County and the city of Pocatello ever faced. And according to the Idaho Office of Emergency Management, it is likely to go down in history as one of the worst fires in Idaho. So personally, from my experience, I used to be a veterinary assistant, and during the Charlotte fire, I was working in a veterinary clinic, and the people who were evacuating, they had to find places to board their pets. So we received a lot of phone calls from owners asking if we had space for their pets because maybe they were staying with a family member who was allergic, or they had to go to a hotel that didn't allow pets. So they were trying to place their pets. We didn't have at the time any sort of information sharing procedure that we could really know what other facilities had available. So pet owners just had to call place to place, hoping to find someone with space. Individual facilities were able to expand their own capacity. For us at the clinic that I worked at, our staff members went home and got any additional kennels, crates, things like that that we personally had and brought those to the clinic so that we could house additional pets. But this was, there were the 66 homes that were destroyed, but even more people than that were evacuated. So a lot of people with pets trying to find placement, and it was just kind of chaotic. So getting into the discussion portion of that, it has been a long time since this happened. So does anybody on the call know if there is currently any sort of process that anyone is using, even if it's among just a couple of facilities, to identify locations for short-term, small-scale sheltering availability? Any type of communication, call down trees, anything like that. Is anybody familiar with any of that that exists anywhere in Southeastern Idaho? Okay, I don't see anything. Chabari?
Hello. I just wanted to share, I'll be facilitating some of the chats today. So if you have any thoughts, you're welcome to come off of mute, or you can also put your comments in the meeting chat as well. But if you do think of something, you're more than welcome to put it there and we'll make sure it gets addressed. Thank you.
Okay. Not seeing or hearing anything, so I'm going to move forward with the assumption that that is an existing current gap that we need to take into consideration for our planning purposes. So next question that I had is there currently any type of a platform where animal care providers can meet as a group to discuss needs and resources in real time? Just to give a little context to this question, for the human medical side of things, there are, they call them medical operation coordination cell calls, a mock call. It's basically a virtual space where representatives from different healthcare facilities get together and talk about shortages, bed availability, things like that, and how resources can be reallocated, patients can be moved, things like that. So I was wondering whether there is anything at all equivalent to that for animal care providers that could be leveraged in an emergency. And same thing here, feel free to come off of mute or type in the chat if you know of anything like this. Okay. I'm guessing that this one is also likely a no. And those are the potential gaps that we kind of thought of. So what other things do you guys think would be needed during an evacuation that we should start taking into consideration as we do some of this planning? What needs have you seen, especially if you've had any experience with an evacuation situation? Okay. Sawyer, feel free to come off mute.
Awesome, thank you. One thought that I've seen as I've talked with other, this is something, so I work for the University of Idaho Extension program and currently working with some colleagues to develop some programming on livestock emergencies and such. But something that would be applicable for both livestock and pets is perhaps a central location for lost animals. whether that is a specific veterinary clinic or the local county fairgrounds or wherever that may be, having a designated place that could be posted in social media or even a newspaper after the fact of, if you've lost animals, this is the location where lost animals have been placed at a specific time. So that'd just be one suggestion.
That is a fantastic suggestion, especially because I do know that during the Charlotte fire, a lot of people just kind of opened their gates and let their horses run. Maybe some of their other livestock too, just to give them a better chance, just to let them run because they didn't have enough transportation for them. So that is a fantastic gap. I really appreciate you bringing that up. Any other thoughts? Okay, we'll move along. So I wanted to take just a moment to share a couple of resources. We can also drop these in the chat, the links that put some QR codes. I know those tend to be a little more convenient. So just some preparedness resources that are out there that you can use, that you can share with other people too. So ready.gov has some pet preparedness information. And then the ASPCA also has some really good pet preparedness information. So if you want to go ahead and open these links and share them with any other people that you know, that would be fantastic. I'll pause just a moment if people are scanning those codes. I believe Tabari is putting them in the chat right now too, if it's easier for you to just click on them. Perfect. Okay, we'll pause again for any more questions before we go on to talk about the Medical Reserve Corps and what we're hoping to accomplish with that. Okay, so just to give an overview of what the Medical Reserve Corps is. So the MRC is a national network of volunteers trained to respond to community health and safety needs during emergencies. So honestly, I think at this point, despite how it started, the Medical Reserve Corps is not restricted to medical personnel. So it's kind of a misnomer in a way. You are not required at all to have a healthcare background. Anyone who wants to improve the health and safety of the community can join the Medical Reserve Corps. So in Idaho, the MRC is housed under the public health districts. And we were considering starting an animal subunit for our MRC. There are other MRCs throughout the country that have done similar things that we can kind of model off of a little bit, but we kind of wanted to just kind of ground up, get some input from the people who are kind of already working in this space a little bit. We don't want to just make assumptions necessarily about what's needed and what's going to work. So a couple of capabilities that we have that we wanted to share to have people at least have in mind. So we can facilitate information sharing between emergency managers, first responders, and MRC volunteers. So a lot of times we will already be in contact with the people who are managing the emergency, and we can kind of relay some of that information to our MRC volunteers. So we might be able to get more timely information, more specific information on, for instance, exactly what areas are going to be evacuated or planning to evacuate, you know, status of different, you know, just situations in general. So we can share some of that emergency information pretty rapidly because we're already plugged into that. We do have a mass notification system that we use for our MRC volunteers, and we can rapidly facilitate virtual subunit meetings. So we can set up a Teams meeting basically that functions the same way as this webinar. We can set those up in just a matter of minutes and invite our MRC volunteers to that. So those are some capabilities that we just already have that we think would apply really well to the subunit. Ideally, what we would like to do is let the subunit have kind of its own leadership. So we would facilitate getting the subunit together, but somebody who is within this space, we would like to have be more of a leadership role, just because the better knowledge and we in public health preparedness, for the most part, we have some supporting staff, but mostly it's 2 staff members. Tabari is our training and exercise coordinator. We are the ones that do most of the preparedness work. And so because there's only 2 of us, we can take any support that we can get a lot of the time. And I have been speaking specifically to Colorado's Veterinary Medical Reserve Corps, which I highly recommend that if you're interested in something like this, just take a look at their website. They have a really robust program. I spoke to their director, got some ideas, and she also offered to, if we do establish a animal medical reserve corps, to do some virtual training for our members. So some of the suggestions that she had, which really ties into what you raised, Sawyer, she said that one of their procedures is that they try to move as many animals out of the shelters as they can, out of the regular animal shelters. So transferring them temporarily to like foster homes, things like that, so that the shelter itself or the Humane Society or whatever locally, so that that can be used for housing lost pets and pets that can't be placed in other places. And then that is like a centralized location. So that was one recommendation that she had for that. Fairgrounds would definitely be another one to look into. So we have a lot of things that we can kind of model off of, but these are kind of the things that we're working with to begin with. So I'll put this registration information up here while we discuss what you guys think a medical reserve corps for animals could look like. Do we have any thoughts knowing those potential? And I think Tabari is going to drop the link into the chat as well. So we'll take any suggestions for what a volunteer group to support this could look like. Or just comments on what you think about the capabilities that we have. Would those work well? And is this something that you guys are interested in participating in? Is another good question. Any thoughts at all? I will accept. You can come off of mute or type in the chat. We will also have a feedback survey that you can provide information to. I know this may have been a lot to think about. Like I do potentially have a comment coming in. Okay, yes, definitely a concern this year with the fire season. Absolutely. We are concerned a lot more about different evacuations that are going to need to happen. So we would like to get out ahead of that if we can. Okay, not seeing any other thoughts. So for the registration, so there is the link in the chat. There is that QR code there. So you just register at the Volunteer Idaho. You'll get a welcome text message that you'll just reply start. And that is something that we will just use to send out actual notifications. You're not going to get like spam text messages, things like that. We do recommend that you add this no reply at mail.jubari.com to your trusted senders so that you do get the emails. And again, these are emails that we specifically would send out. And then if you're interested in signing up in a leadership role for this, just send us an email. I'll take just a moment for any other questions. Okay, so we do have this feedback survey that we would really appreciate if you complete. So this is to let us know what you thought of today's presentation, what you liked, what you didn't like, if you found it applicable to you, and a space to request any future educational opportunities as well. We'll get that in the chat as well. These are the sources for the presentation. I'm happy to share these if anybody wants them. Here is the contact information for us in preparedness. So at the top, we've got our main office number and our group preparedness email. So that is the best way to reach us because that emails all of us in preparedness. So that's preparedness@sif.id.gov. On the left hand, so I am Lori, the preparedness planner. So that's my contact information. Tabari, who's been helping out in the chat, our training and exercise coordinator on there. And then we just have our financial disclosure for our funding source. Want to mention that we do have 2 more sessions in this series. So they are both focused on zoonotic disease. One of our epidemiologists is going to be doing these presentations for us. So next week, we're talking about current zoonotic disease threats happening in Southeastern Idaho, including some case studies. That should be pretty interesting. I believe she is going to speak about things like the anthrax in cattle that happened a couple counties over from us, some things like that that are relevant going on right now. And then the week after that, we will be talking about zoonotic disease threats that are being monitored because they have the potential to cause pandemic issues. So any of these zoonotic disease threats are always going to be a concern during a disaster, just because you have more exposure to animals in a shelter or in a sheltering situation. So we found these relevant to the series. And we appreciate you attending the session. So again, my contact information there as the presenter is on the top. You've got the link to our feedback survey again. And on the right is the registration for the other sessions if you're not already registered for those. And then our general contact information at preparedness@sif.id.gov and our group phone number that rings to all of us. And any other questions or concerns, I am happy to answer. But that is the end of our session today. I very much appreciate everybody attending this. I'm not seeing or hearing anything, so we will end this for today. Again, this will be available on our YouTube channel. Thank you for attending.